Hello and welcome to your 2020 Open Enrollment. Today we will go over a few items: your medical plan with Aetna, your new dental plans and vision plans, and go over your voluntary products. Open enrollment begins October 22nd and ends October 31st. Please make sure that you go into the D2 system and pick your choices either by enrolling or waiving your coverages. Your benefits will be effective January 1st, 2020 until December 31st, 2020. Aside from yourself, your legal spouse and domestic partner and children up to the age of 26 are all eligible for coverage. As stated earlier, your benefits begin January 1st, 2020 until December 31st, 2020. Within that plan year, if you have any changes, you must be able to produce a notice of qualifying event, such as marriage, divorce, birth of a child, loss of coverage, etc. Make sure you notify your Human Resource Department within 31 days of the day of the event. If you go past the 31 days, you will have to wait until the next open enrollment period to make changes to your medical, dental, or vision. We will go over all of your medical plans. All of your medical plans are with Aetna. The first plan is Open Access Managed Choice 2000. The Open Access Managed Choice is the network. So we'll go over the plans. This plan has a $2,000 deductible for an individual, $4,000 for the family. Keep in mind with all the plans that are not high deductible health plans, you will start to pay your deductible with major services such as inpatient surgery, outpatient surgery, major testing like MRIs and CAT scans. On this plan, if you meet your deductible, then you will have to cost share with Aetna. You pick up 20% of the cost and Aetna will pick up 80%. Your maximum out-of-pocket in this plan is $6,350 for an individual, $12,700 for the family. So once you've met your out-of-pocket maximum, you will be into 100% coverage in the network and within a calendar year. On all of the plans, the preventative care is covered at 100%. Make sure you schedule your preventative exams with your primary care physician every year. In the event that you need to see a provider for a sick visit, it's a $30 copay for this plan and $60 for a specialist. Now, on all of the plans that we will review today, you can self-refer to specialists. You do not need to have your primary care physician write any type of referral. Urgent care copay on this plan is $75. Emergency room copay is $250. Now, with all the plans, if you go to the emergency room and you are admitted, they will waive the copay or the amount of money they want to collect, and you will start to pay your deductible. With all the plans, you do have a 30-day retail prescription available. On this plan, it's $3 or $10 for your generic, $35 for your preferred brand name, $60 for your non-preferred brand name, and 25% up to $250 for your specialty medication, which includes injectables. You also have the ability to order your medication via mail order. You get 90 days for 2 retail copays. Your physician does have to write a 90-day prescription. The next plan is the Open Access Managed Choice 2500. Again, Open Access Managed Choice is the network with Aetna. So the deductible for an individual here is $2,500, for the family $5,000. Then again, the cost share with Aetna, 80-20. You pick up 20% of the cost until you meet your out-of-pocket maximum. It's $6,350 for an individual, $12,700 for the family. Again, preventative care covered at 100%. On this plan, you get 5 visits at a $35 copay for your primary care physician and your specialist. If you exceed those 5 visits, then you will have to pay the contracted negotiated rate with that provider. Your urgent care and emergency room are subject to your deductible first. You also have the 30-day prescription, same as the other plan, either $3 or $10 for your generic. Preferred brand name is $35. Your brand name, non-preferred brand name is $60, and your specialty medication is 25% up to $250. And again, you have the ability to order 90-day supply via mail order. Next, 2 plans. So again, Open Access Managed Choice. This is a high deductible health plan, which means it is deductible first with the first visit. Other than preventative care, some maintenance medication, and contraceptives, you will have to pay towards your deductible for all services. So on this plan, you have a $3,000 deductible for an individual, $6,000 for the family. Then you have a cost share of 90-10. So once you pay 10% up to $5,000 for an individual, $10,000 for the family, you will be into 100% coverage. Your preventative care is not subject to your deductible, which means you can still make your appointments for all of your preventative care for yourself and everyone enrolled in the plan. Your office visits for regular doctors, specialists, urgent care, emergency room, and pharmacy are all going to be subject to your deductible first. Now keep in mind you can open your health savings account or HSA and put away pre-tax dollars into an account to use for these services. We'll go over that in detail. The next plan under the Open Access Managed Choice Network is the 6350. 6,350 is your deductible, 12,700 is the family deductible, and if you should meet that, you have met your out-of-pocket maximum as well, and you're into 100% coverage in the network in a calendar year. Again, preventative care is covered at 100%. On this plan, if you need to see a doctor for a sick visit, it's a $25 copay. Specialist, urgent care, and emergency room are all going to be subject to your deductible first. You do have the ability to have your 30-day prescriptions not subject to your deductible. So you still have those copays available, and you do not have to meet your deductible for those copays on this plan. The next couple plans that we're going to go over are the Banner Network. So Arizona only plans. Banner networks from North and South include all the Banner plans and Honor Health facilities. So this plan is a $2,500 deductible for an individual, $5,000 for a family. And then cost share, Aetna will pay 70% and you pick up 30% until you reach your maximum out-of-pocket of $6,350 for an individual, $12,700 for a family. And same as the other plans, this also has preventative care covered at 100% with no out-of-pocket cost. And this plan, if you want to see your primary care physician, it's a $30 copay. Your specialist, $60. Urgent care, you have a $75 copay, and your emergency room is $250. Again, you have your prescriptions, a 30-day retail supply. The copays here change just slightly from the Open Access Managed Choice. So your generic medication is $3 or $10. Your preferred brand name is $35. Your non-preferred brand name, you're going to pay 50% of retail. Specialty medication here is 30% of retail up to $350. And again, you have a 90-day supply at 2 retail copays. The next plan is your Banner 6500. Again, this is in the Banner network, so your deductible as an individual is $6,500, $13,000 as a family, and then you're into 100%. If you met your deductible, you have also met your out-of-pocket maximum. Your preventive care, again, covered at 100% prior to any deductible. Your office visits, copays for your regular doctor, sick visits, $30, specialist, $65. Your urgent care, your emergency room, those are all going to be subject to your deductible first. Again, same retail copays as the other plan. $3 and $10 for your generic, $35 for preferred, 50% for non-preferred brand name, and 30% up to $300 for your specialty medication. Next, we're going to go over a health savings account. So you do have the option to enroll in a high deductible health plan, and you can pair that with a health savings account. If you currently are enrolled in a high deductible health plan and you have an HSA, you can continue to use that same HSA account for the 2020 plan year. Keep in mind, all of the money that's in that account is your money. It will stay with you and roll over year. You can continue to add money into your health savings account as long as you continue to be enrolled in a high deductible health plan. So how does a plan work? So you select a dollar amount that you want to set aside, again, pre-tax dollars, and that helps because it lowers your taxable income. That money goes into a holding account and you will be given or mailed a debit card to use for your services, such as copays, prescriptions, things of that nature. You can also use the money for vision and dental care. Keep in mind, for the 2020 plan year, the maximum you can set aside as an individual is $3,550 and $7,100 as a family. If you're 55 plus, you can add an additional $1,000 per calendar year. There are a couple of rules to be qualified for a health savings account. One, you have to be enrolled in a high deductible health plan, which you have the option to to do so. You cannot be covered by any part of Medicare. You cannot be enrolled in another plan, and you cannot be somebody else's dependent on their tax returns. Just a reminder of your annual maximums. Next, you have the Healthcare Flexible Spending Account and Dependent Care Flexible Spending Account. So these plans begin January 1st and run through December 31st. If you're enrolled in the Flexible Spending Account today, the Healthcare Flexible Spending Account today, and you have money in that account that exceeds $500, I would recommend you to utilize some of that money. The maximum you can carry over to the 2020 plan year is $500. Anything in excess of $500 on December 31st will be forfeited. Again, if you want to enroll again for the 2020 plan year, you do have to fill out a form. It does not renew automatically. It does not carry over. The maximum you can set aside is $2,500. And if you elect that $2,500 or any amount, it will be front loaded on your task Visa card. So when you receive your card in January, you will have the full amount ready to utilize for medical services such as copays, prescriptions, dental, LASIK, medical supplies, things of that nature. And then the money will be deducted per check on a pre-tax basis for the rest of the year. Keep in mind, if you enroll in a high deductible health plan and the health savings account, you cannot enroll in the healthcare FSA. You have to pick one or the other. Dependent care FSA, similarly to a healthcare FSA, you pick an amount to be deducted from your paycheck every pay period. Again, pre-tax dollars, lowering your taxable income. This money goes into a holding account. It is not front-loaded. It goes into an account for you to utilize to pay daycare services, pay yourself back, or pay for adult daycare as well. Here are some Aetna resources. So you and everybody enrolled in the Aetna plan have a few services available. One is a nurse on call. It's 24/7, 365. You can call a nurse and talk about current medical conditions, drug interactions, side effects of new medication. They could also guide you if you need to get to the urgent care emergency room, or if what you're feeling or going through is normal side effects and things of that nature. It's a really good phone number to have handy because they will have all of your medical records at their disposition and be able to talk to you in regards to your current medical status. You also have resources such as Global Fit, so wellness programs and gym discounts. And like everybody else, Aetna also has their mobile app. I recommend you download so you can find a pharmacy, urgent care, and review your claims on the go. Everybody enrolled in Aetna also has the ability to enroll in the teledoc, so that is free service. There are copays associated with that, but that is also a mobile app that you download on your phone. So if you're enrolled in any of the plans other than the high deductible health plan, your copay for this plan will be whatever your primary care physician copay is. Whether it's the $35 or the $25, that will be your copay for regular general medical visits. Now, if you're enrolled in the high deductible health plan, your copay is $45. You also have dermatology and psychiatry available via the Teladoc app. I recommend, if you have not done so, to go onto the website, register, and then download the app to your phone so you're ready to use it. You can also use your flexible spending account dollars or your HSA dollars to pay for these visits. Next, we're going to go over the new dental plans. So the new dental plans begin January 1st, 2020 until December 31st, 2020. So the first plan is your typical PPO dental plan. So your preventative care services, such as your cleanings twice a year, are covered at 100%. Your basic services, such as a cavity, you're covered at 80%, and you pick up 20% of the cost. And at this point, you will have a one-time $50 deductible or $150 for a family, and you pay that only one time. Major services such as a crown, it's a 50-50 cost share between yourself and Delta Dental. If you did not pay your deductible with the basic services, you will be subject to that at this point. Again, you only pay that once a year. Your annual maximum, which is the amount that Delta Dental will pay on your behalf for everybody enrolled in the plan, is $1,500. And new this year on this plan, you also have $1,000 to use towards child orthodontia. The new DHMO program is similar to the old one. You have no annual deductible and no annual maximum. So you can utilize the plan throughout the year and you are not subject to any deductible. Your preventative services, again, are covered at 100%, and all of your other services are going to be a fee schedule, which is a set dollar amount. You do, under the DHMO program, have to select a primary dentist or primary care doctor, and notate that in your Delta Dental portal. You can change the doctor at any time within a month, within the year, multiple times, and each person enrolled on the plan may have their own primary care dentist or doctor. Here is an actual fee schedule for the Delta Dental DHMO plan. So this is the basics or diagnostic services portion of it, a small portion of it. Everything on here is at no cost to the member. So your x-rays, your cleanings, etc., those are all covered at 100%. Now you get 2 cleanings throughout the calendar year. If you need additional cleanings, they're $45. So once you enroll in this program and you picked your primary care dentist, you will get an ID card similarly to the one here on the screen with your information on it. You'll also get a letter giving you the information on your primary care dentist. Now, like I stated earlier, anytime during the year, as long as it's done before the 25th of the month, you can go onto the portal or call and you can change your dentist. If you do not pick a primary care dentist, one will be assigned to you based on your home zip code. Here are some resources that will be available to you at the beginning of the year through the Delta Dental AZ portal. Couple of things that you can utilize here. They have a mobile app you can download to find a dentist near you or to review claims. You can go onto the website and check your benefits and eligibility, review your claim statuses, print ID cards, and do some research there. You also have the ability to do an oral health risk assessment and see what your scorecard is, and then find a physician to help you in maximizing your care. Next, we're going to go over the vision plan with iMed. So a little bit of a difference. Today in 2019, we have iMed with the Select Network. We are moving to the Insight Network. A few changes. You still have the $10 copay for your exam every 12 months. And this is an enhancement to the program. Now you can have your frames every 12 months versus every 24 months. So again, $120 allowance to use towards your frames, and then you have a 20% discount anything over $120. Your single vision, bifocal, or trifocal, those are a $10 copay. And also if you need to have any tinting, things of that nature done to your lenses, that will be at a copay. Contact lenses in lieu of glasses is every 12 months. So you can get your frames and your glasses 1 year. And then the following year, if you want to update your frames, you can do so. And then you can get contact lenses. So contact lenses, you have an $80 allowance to utilize towards that service and 15% off anything over that. All medically prescribed contact lenses are covered at 100%. Just an enhancement to the program this year, and a reminder, it is now the Insight Network versus the Select Network. Voluntary life and accidental death and dismemberment, so you still have the ability to enroll in your life insurance plan. If you are enrolled today under the Unum plan, and you have not reached the guarantee issue, you can continue to increase that life insurance until you reach that 5 times annual salary up to $200,000 with no medical underwriting. If in the past you waived the opportunity to enroll in the life insurance and you choose to do so at this time, you will have to answer a few medical questions. If you're newly eligible or new employee and you're enrolling for the first time, you can enroll up to 5 times annual income, up to $200,000 with no medical underwriting, spouse $25,000, and children $10,000. Again, only if you are newly eligible, newly employed, or you already enrolled last year for the opportunity for the life insurance, you can continue to increase that with no medical underwriting. If you waived your opportunity to enroll in years past and now you want to enroll, you will be subject to evidence of insurability, which includes some medical underwriting questions. You also have the opportunity to enroll in the short and long-term disability programs. The short-term disability programs cover 60% of your pre-disability weekly earnings up to $1,500 a week. Benefits begin after the 14th day of accident and sickness. So these are non-work related illnesses or accidents. The benefit duration is between 4 and 6 weeks. There is a pre-existing condition limitation, and that is if you go out on disability for something you saw a physician or took prescriptions in the last 3 months from the eligibility date, you will be excluded from coverage for 12 months. Your long-term disability, also 60% of your pre-disability monthly earnings up to $7,500. The elimination period is 90 days, and this benefit does last until normal Social Security retirement age. You also have the ability to enroll in the colonial products that are available to you. So you have the accident policy that's available, short-term disability, hospital policy, critical illness, life insurance, and you also have the ability to enroll in the telemedicine with MD Live. Now, if you're enrolled in any of these plans today and just continue to move forward with those, you do not have to do anything. If you need assistance in updating information or enrolling or visiting with Kent Biswanger, please let us know. We'll be happy to have him contact you. Other offerings, your Legal Shield and ID Shield. Your Legal Shield giving you free unlimited legal consultation, standard will preparation, letters, phone calls on your behalf, 24/7 emergency assistance as well. Credit monitoring is just that. They monitor your credit, identify any issues, help with restoration of your identity, making calls to creditors and credit bureaus on your behalf. You also have the ability to enroll in the United Pet Care Program. So this is a discount program for your pets. You do need to visit the website that's listed here on the packet you received in order to enroll both in the Legal and ID Shield and the United Pet Care Program. The United Pet Care is about $10 a month per pet. Just a reminder, everyone must complete the D2 enrollment by October 31st with no exceptions. Again, if you are enrolling or waiving, everybody must complete. If you're enrolling in life insurance or increasing your life insurance policies, please do so. We will send the forms out. They must be completed and returned. If you're enrolled in the medical flexible spending account or dependent care flexible spending account and you wish to re-enroll for the 2020 plan year, you must complete a form. This does not automatically renew. Your health savings account, if you are enrolled today and you have a UMB account, you can continue to utilize it. If you're enrolling in the high deductible health plan, you must open your UMB account and notify your human resource team here at CBR know that you've done so we can start putting your pre-tax dollars in that account to utilize for your services. Thank you so much for your time today.